Welcome to the Dr. Journal Club podcast, the show that goes under the hood of evidence-based integrative medicine. We review recent research articles, interview evidence-based medicine thought leaders, and discuss the challenges and opportunities of integrating evidence-based and integrative medicine. Continue your learning after the show at www.drjournalclub.com.
Please bear in mind that this is for educational and entertainment purposes only. Talk to your doctor before making any medical decisions, changes, etc. Everything we're talking about, that's to teach you guys stuff and have fun. We are not your doctors. Also, we would love to answer your specific questions. On drjournalclub.com, you can post questions and comments for specific videos, but go ahead and email us directly at josh@drjournalclub.com. That's josh@drjournalclub.com. Send us your listener questions and we will discuss it on our pod.
Hello, everybody, and welcome. This is Josh and Adam at the Dr. Journal Club podcast, and today we have a very special guest, Dr. Martin Gurvey. Now, am I pronouncing that right? It's Gurvey?
That's correct.
Awesome. And Dr. Gurvey is a chiropractor. We met at the PI conference, which, if you haven't heard me talk about it ad infinitum or ad nauseum, depending on your perspective, it is the best conference for EBM nerds like all of us listening. And it's every 2 years. And the last one was at CMCC, which is a Canadian chiropractic college. And Dr. Gurvey, are you a professor there, faculty there? Tell us a little bit about yourself before we jump in.
Okay. I graduated from the Chiropractic College, CMCC, 41 years ago, hard to believe. And then I was in full-time private practice in Winnipeg, Manitoba for 29 years, moved to Toronto 12 years ago, and sort of got my foot in the door teaching a couple of courses at the Chiropractic College. And now I'm probably about 75% of my time teaching and 25% still in clinical practice. And I'm an instructor, so I'm still doing quite a bit of clinical practice, but I've really loved mentoring the younger students and giving back after all these years of practice. And so I love teaching there and look forward to doing it for a few more years.
Awesome. And for background, so these PI conferences where I met Dr. Gurvey, we have these small groups where I was facilitating. We have a group of maybe 10 of us or so, and we're talking specific EBM skills like risk ratios, numbers needed to treat. We go through teachings. It's all for faculty. We go through teaching examples. And I've been doing this for years. I've been on the planning committee for like a decade, and it's always been, let's do a likelihood ratio. Let's do a risk ratio. Let's do odds ratio, like something like this, which I love, right? Don't get me wrong. But for the first time ever, we had a fascinating conversation about the philosophy of evidence-based medicine and how that juxtaposes in good ways, bad ways, neutral ways with vitalism, which is important to chiropractic history as well as naturopathic history. And that conversation turn was all due to Dr. Gurvey, and it was amazing. So much so, Martin, I didn't tell you this yet, but we had a wrap-up meeting with PI, and I was like, so this happened, and this needs to be our new thing, right? Because PI is for integrative professions, right? Chiropractic, naturopathic, you name it. This is such an important issue for us. We have this vitalistic history. We have this EBM bent. How do they play together? What is the philosophy there? What is the pragmatics when the rubber hits the road of that? And that stuff just fascinates the heck out of me. I got stunned silence when I suggested that we make this a new tenant. But anyway, so that's why we invited Dr. Gurvey back, and I would just love to continue that conversation.
Sure. I mean, the reason I sort of came up with that, I don't have a really strong academic background per se. Like I say, I'm mainly a clinician. So a lot of those research themes that you've traditionally done, I'm kind of learning now too as we're teaching it to the students. But I have been involved. I was the registrar of the Manitoba Chiropractors Association for 8 years. I've been a facilitator of research. So I'm not a researcher, but I was on the board of the directors of the Canadian Chiropractic Research Foundation for 27 years. So I have an active interest in research without sort of being a, quote, research nerd in the lab. And so when I was registrar, we would have situations where there were complaints made against certain chiropractors who were doing questionable things or things that people wondered if it was really chiropractic, and paying agencies wondered, should we pay for this? So because I sort of felt that I do have a certain evidence-based or scientific bias, and just from my own personal interest and reading in that, I thought to attempt to be more objective in looking at these complaints is that I should make it a hobby to go to some, quote, vitalistic chiropractic seminars, so I could actually see exactly where some of these people were coming from without automatically criticizing and judging and being condescending, as we're really apt to do. And so I found it really interesting, because I found that, similar to some research that was done in chiropractic a number of years ago, amongst the so-called vitalists and so-called evidence-based chiropractors, probably 82% of what we do based on a very long questionnaire was the same. And then it was this 18 to 20% that the media loved to pick up on, and the medical doctors love to criticize us for. And this is where, we've run into some of the problems with credibility and cultural authority that I think you'd probably agree has stifled both of our professions from becoming more so-called mainstream and integrated into the, at least, Western medical world.
Yeah. Adam, you've been in the naturopathic profession for a while. You're kind of in the trenches daily, if you will, in clinic. And I'd love to know your thoughts on how this question about vitalism and practice plays out within naturopathy. And I've always been pleasantly surprised, well, I guess interestingly surprised on the parallels between these questions within chiropractic versus naturopathic. What are your impressions?
Yeah, I think that it seems like there's a shared, perhaps problem is the wrong word to describe it, but the same sort of tug of war when it comes to the professions of sort of this idea of losing our quote unquote roots for the advancement of medicine, and a fear of becoming too Western in sort of our practice or our philosophies. Now, I am one who thinks that if you're too far on either end, it can be problematic. I do think that there's a sweet spot. However, I think when it comes to the vitalistic approach, that is more of a philosophy. And I think a philosophy should be used sort of as a base framework from which to work from, and from which shouldn't consume you to make all of your decisions. I think the idea of sort of this vitalistic approach when it comes to naturopathic medicine is kind of, trying to do as least harm as possible, trying to be as quote unquote natural as possible, whatever that means, and trying to avoid things like medications and surgeries and whatnot. And on the flip side, where you're entirely only evidence-based medicine, and we've talked about this on previous episodes, is essentially kind of like ignoring the patient in front of you and only practicing based off of the trials that you have. and not kind of taking into account the real world setting, sort of this external validity that sometimes can get lost from trials. Because when you're doing trials or other sort of forms of research, you're trying to answer a very specific question of, does intervention influence some sort of outcome X, right? If I give you this drug, does it do this effect that I'm looking for? Does this exposure to a risk, does this exposure confer some sort of a risk to a disease? And you're trying to answer that question without any sort of influence to see if that particular thing that you're trying to study is actually having an influence. So it can become very isolating. And so things can become lost within that. And so as a clinician, you can sort of you miss the forest through the trees in that approach of, okay, if you become so evidence-based that you don't take into account patient preferences and logistical concerns and all these other things, then you're not really necessarily practicing evidence-based medicine. You're just more so trying to shove trials down people's throats, and it may not be worthwhile. On the flip side, from a vitalistic standpoint, if you're doing things that are outdated, or practicing in a way in which medicine and science has evolved to offer better treatments, safer treatments, more effective treatments, things like this, then I think to practice based on a philosophy solely because it's a philosophy, you're now just kind of holding on to sort of like a religion and trying to apply a form of like religion onto a patient, which can be very harmful.
Just to pick up on what Adam was saying, if I may. So I totally agree with that. And what sort of got my attention in the last few years is that in our profession, some of the so-called vitalists or even vitalistic leaning chiropractic colleges have now been branding themselves as evidence-based.
Mm-hmm.
So I got to thinking, well, that's interesting. Why should we just have this divide between so-called vitalists and evidence-based that's been so divisive and restricting, I think, the progress of our professions more into the mainstream field for helping patients? Why don't we just base it on the weakness or strength of evidence for whatever they're presenting, and sort of educate the practitioners and the public on the strength of the evidence? So if a practitioner is doing a technique or procedure where there's just very low level evidence, a case study, for example, that's where it is. It really doesn't matter whether you're a vitalist or not.
Mm-hmm.
If you're doing now on that extreme, for example, like I might, and I'm open to taking in a patient whose parent brings them in for bedwetting, for example. So obviously, there's very little evidence for that. There are a number of case studies and maybe something a little bit higher, but I don't have a problem putting into context and explaining to the parent that there isn't a high level of scientific evidence in the literature for this, but we do have anecdotal stories and case studies that our approach may help enuresis. So if you understand that, I'm not going to make any guarantees. We'll work with your child maybe for a month, 6 weeks, see if we're getting anywhere. And if we are, we'll continue. If not, at least we tried. So just so you understand. And so, that's something that we have to do one-on-one with the patient. The problem comes when our members start advertising this kind of thing to the masses and the public, that chiropractic can help this or can cure that, as opposed to, the things that we're most noted for is a large level evidence of the effect of manipulation for low back pain, for example. So if we just frame it that way, it doesn't really matter, if you're vitalistic or so-called evidence-based. We're all evidence-based. Just some of us are practicing some things that have low evidence. Some of us are practicing things that have high evidence. And also, as a very experienced practitioner, I have seen a lot of things that have worked and the patients like. So in the full context of total evidence-based or evidence-informed care, we really have to give equal and maybe even more in cases where there is very little scientific evidence on the doctor's experience and patient preference, as long as we're not putting the patient at risk.
Mm-hmm.
So I sort of think that approach would serve both our professions much better in terms of acceptance and prevalence into mainstream healthcare.
Yeah, and I would agree with that. And I think it's also important to not be so dogmatic that you become biased when you're kind of using your sort of approach to evidence-based medicine in either direction. So if you're, a quote unquote vitalist, that you're not searching for evidence to only support what you're doing and kind of ignoring or refuting anything that has, any sort of evidence to suggest against the intervention that you're promoting. And so if you have, let's say, an intervention that's supported by only one trial, and you're kind of applying that to everybody, especially if it's like a low level type of trial, high risk of bias, only a couple of people, short duration, that kind of thing, and you're saying, oh, we should use this for everybody. See, I have evidence. Well, I think that is still harmful, if not more harmful than just saying, well, in my experience, I've treated thousands of patients this way, and I don't have any sort of hard evidence to support it, to promote it. I think that if you have very low level evidence and you're just kind of using that to promote something across the board, I think that can be also harmful. And I think on the flip side, sometimes what we see within the evidence-based medicine community is, oh, there's no evidence to support what you're saying, therefore we shouldn't use it. And you then kind of the argument of, well, absence of evidence is not evidence of absence. And I think that that's something that also needs to be taken into account, where, hey, this is just a field that is lacking in the research setting, and something that we actually have to investigate through research. And is now we have a lot of hypotheses that we need to test. But I also think that, just like you were saying, where anyone can be quote unquote evidence based if they're just holding a paper and kind of ignoring sort of the deeper aspects of that paper of, okay, what was how biased is that paper? What's the quality of that paper, et cetera, et cetera.
Yeah. I want to double down on something here, because I think when we're saying, everyone can be evidence-based, or there's always some level of evidence and we have to watch it, I think there's a desire, at least on my end, to say, well, we can all get along, and this is all just a different, two sides of the same coin, or something like that. But I think clearly there is a difference, and I think people have described it in different ways, like the article you sent, Dr. Gurvey, about camp. I think they talked about different camps. We've in naturopathic medicine, we often talk about that in the same way. My understanding with chiropractic is that schools have now kind of bifurcated along certain lines. So there's clearly something there that if you ask someone in the profession who's on one camp or one side of the spectrum and who's on the other, like, people would very clearly be able to say. What I struggle with is like finding that definitional difference. And I'm curious about that, because I wonder what it means to be an evidence-based doctor. I really do. And I think to just, like Adam said, slavishly follow studies is not evidence-based medicine. To cherry pick evidence that meets your criteria, even if it's great evidence, is not evidence-based medicine. So I want to get your guys' thoughts on this, but to me, it's a very subtle thing. And I think that the more I think about it, Martin, do you remember there was a talk at Pi where someone got up there, I think he was a chiropractor, and he said, what would we all do? So this is an audience full of chiropractors, chiropractic faculty and deans. What would we do if tomorrow a really well-conducted study came out and said that chiropractic doesn't work? And I just remember there being this like gasp in the audience. And my joke that I told Adam before is if this was at a naturopathic conference, there would be a riot. And so I think it's to, the chiropractic benefit that they they didn't riot. But that, I think that is the question. And I would like to believe that if that happened in my field, the first thought that would go through my mind is, that's interesting. I need to reevaluate versus there must have been something wrong with that study. Let me use the skills that I've learned to pick it apart with these with this bias, with this bent. So anyway, so that's the closest I can get to understanding an operational difference. What do you guys think? Is there really a difference? Is this a definitional issue? And if so, like, how do we define that?
Well, I'm very kind of aligned with you in that, Josh, of pausing, going, that's interesting. Let's explore that. I think the issue is in trying to understand, okay, but why are people getting upset of, hey, of kind of challenging your bias, really, of, hey, I have evidence to show that what you're doing, I have significant evidence to show that what you're doing is not appropriate or is not working, or that there are better alternatives to your approach. Why are people getting upset by that instead of having the mindset of, time to reevaluate and time to kind of consider these other things and move in a different direction? Because if we think about medicine as a whole, that's exactly what medicine has done since its inception. We've constantly been trying to evolve in saying, maybe we shouldn't use leeches. Maybe we shouldn't be using this medication because it's causing a lot of harm. Maybe, opioids for pain actually was not a good strategy at all. And, we're seeing the consequences of that, depending on the situation, of course. But for, a lot of people, for chronic pain management, we made a big error there. And so now we're trying to adapt, and it's, why are people getting sort of ingrained in their beliefs or their philosophies and unwilling to change, and then creating a divide, I think is the big issue.
Yeah, I have kind of a couple of thoughts on that. First of all, when I was involved with the Research Foundation, and we sort of publicized that we were looking to raise funds for, quote, chiropractic research, we thought, well, what is chiropractic research? Is chiropractic research just inviting any studies and results of studies that shows that something does or does not work, and therefore it's all about what's best for patients, which we thought, whenever there's any kind of conflict, it always comes back to what is best for the patient, even if it shows that chiropractic maybe, or I don't say chiropractic because that's a profession, and that's where some people get sort of mixed up that all we do is adjust spines, but we're wellness coaches who happen to use manipulation as one of the things in our toolkit. But we have to be prepared to say that, well, spinal manipulation doesn't appear to be effective for that, so we've got to be mature enough to move on. However, what gets in the way is, our biases. We make our living doing this. We have a certain way of thinking. It's our attitude. And this is prevalent in the medical world as well, because a lot of recent studies are now showing that surgery for low back pain does not appear to be that much better than using conservative means, and there's much more risk of developing problems down the road. But surgeries for back pain in North America anyway are being done at record levels. So it's not changing because too many people are making their incomes on that. They don't want to, and you can understand why, and the same reason why the professionals would walk out the room if it showed that what we do does not really make a difference, and it's all placebo, or people can do it on their own. Another research foundation based in Australia, they seem to want to promote research that shows why chiropractic or why spinal manipulation works, or why chiropractic works or is a good thing. And obviously, depending on your approach, that shows a huge bias on the type of studies that you're going to fund, and potentially even what you're going to publicize and publish and not publish. I think there's a lot of examples, and I suspect, I don't know for sure, but I suspect in the pharmaceutical industry that a lot of things that show that the medication is not effective are just not published. They're just not published or publicized, as if they didn't happen. They just publicize the thing that fills your bias. So I think we have to be a little bit more mature about what's best for patients, even if we risk slitting our own throats. But I think people and professions being the way they are, I'm really doubtful that that'll ever happen, because it's certainly not happening in the pharmaceutical industry, despite all of the, things such as some that were referred to are not effective.
Yeah, I'm curious. Maybe we can take the conversation in that direction. I think the other big question here is, we're all guild members, right? Like we're card carrying members of our profession also, right? So we're doctors here to help patients, and we're members of our profession. And I think, wearing those different hats can mess and have different interests, and sometimes those interests can conflict. And so, I want to talk more about that, because I felt that also in naturopathic medicine. When I would interview people for years about naturopathic research, it was all about, oh yeah, we need research. Why? To validate what we do. We need research to get more insurance coverage, or to prove to those deniers that what we already know works, right? And so there was no and that is like the antithesis of research, right? Like the idea that you're going in with a preconceived outcome to find, like, that is literally the opposite. And I think it was viewed as a way to get that street cred that was desired. So that's one thing that I've definitely seen too. Look, the thing is, we don't do this for money. This is pro bono, and quite honestly, the mothership kind of ekes it out every month or so, right? So we do this because we care about this. We think it's important. We think that integrating evidence-based medicine and integrative medicine is essential, and there just aren't other resources out there. The moment we find something that does it better, we'll probably drop it. We're busy folks. But right now, this is what's out there. Unfortunately, that's it. And so we're going to keep on fighting that good fight. And if you believe in that, if you believe in intellectual honesty in the profession, in integrative medicine, and being an integrative provider and bringing that into the integrative space, please help us. And you can help us by becoming a member on Dr. Journal Club. If you're in need of continuing education credits, take our NANCIAC approved courses. We have ethics courses, pharmacy courses, general courses. Interact with us on social media, listen to the podcast, rate our podcast, tell your friends. These are all ways that you can sort of help support the cause. But also this idea of slitting our throats, like, that's very interesting to me. Is like, how do we as a profession explore in a critical way our interventions without slitting our throats, or more importantly, or maybe not more importantly, but more immediately, without bifurcating the profession? Or maybe bifurcation is necessary. That's a debate we've been having. I think chiropractic's been having as well.
Yeah, I think possibly the way that we can do that is to have more people that are not in our professions doing the research, like PhDs in that particular area, doing the research to not bring that, I'll call, political bias into it. I know years ago, health economists, a team of health economists looked into whether chiropractic care could save the health system. And don't forget, in Canada, we have socialized medicine. Everybody in the medical world gets free health care, although our taxes are higher than anywhere else. But of course, chiropractors, naturopaths, massage therapists, physios, we're not part of that. So they were looking at ways to save money, which is really in a crisis now in some people's opinions in Canada with the quality of care that people are getting and waiting lists, etc. But this health economist came up with some very, very strong evidence that including chiropractic care more in mainstream health could save a ton of money in the system. And this has got to be about 20 years ago. So there was quite a bit more questioning or criticism of the profession. And instead of embracing that, and even though it was done without the bias of being funded, by chiropractic groups and being done by chiropractors, I mean, when Josh mentioned what happens when that's done, this is what happened. The medical community started critiquing the study and bring all the flaws and why it wasn't valid and we couldn't take anything from it. But I thought at the time, and that's why I bring this up now, that maybe we have to look at ways of taking some of the our own biases and the politics out of it and have people that are at least appear to be, don't have skin in the game on whatever the outcome of that particular research would be done. And that's why, we don't want our national associations funding research that, that we just want to make us look good.
I want to give an anecdote, Martin, about what you were saying about politics, and then I want to ask another question. So just anecdotally, I presented at a conference years ago, Adam already knows the story, years ago, proposing a 7th principle of naturopathic medicine, which was critical evaluation, essentially like an EBM principle. And before the paper was even published, sort of presenting on it preliminary form at a conference, at the airport on the way home, I'm getting phone calls from people I don't know who are high, I'm not going to mention names, but high up in the politics, the political elite of the global naturopathic community, basically telling me I should not publish. And like that is literally like publication bias from political pressure that you're describing. Like literally happened to me. I'll never forget it. I could not believe it. I was shocked and appalled. And of course we published, but it just died on the vine. And that's another thing to talk about. But yeah, I think that does happen. Now, I want to ask another, or bring the conversation in our closing minutes to another issue. And this is something, Martin, that I really have always appreciated about you and the way the way you've brought about these conversations is it's always with a curiosity and a desire to, reach across the aisle, if you will, or understand the other side. And that's something we try to do on this podcast. We try to steel man people that maybe we disagree with or arguments that we may disagree with. What's the best possible light? So I guess that's a question for you. You've been in this world for a while in your profession. What do you think we should be doing to have these conversations within the professions as opposed to just kind of pontificating in our little corners of the ring and maybe just, echoing each other, God forbid, like it sounds pretty boring. Like, how do we keep this conversation going in the profession? What's been your experience and what do you think we should be doing moving forward?
I think the key, and I did read that the paper that you were talking about, and I was struck by the 6 principles you could have substituted chiropractic for naturopathy.
Yeah,
word for word.
I know, I know.
I thought, gosh, why didn't we think of that? That would have at least organized it in a sense.
Martin, quick question. So, quick comment. When we were at the dinner at the conference, I went into the gym where the dinner was held, and on the wall was this big banner that said "Vis Medicatrix Naturae," which is like a principle of naturopathic medicine, the vital force. And I was like, oh yeah, this is a chiropractic theme as well. And again, just reinforcing that commonality. But yeah, sorry to interrupt. Go ahead.
Yeah, all 6 of them are chiropractic themes. And for my part, I would love for the 7th one to be added, because I don't think there's really anything to fear if we're mature about it. But just getting back to your question, I think the key is how we how we talk to our students in our colleges. As someone that doesn't have a strong academic background really, and is a clinician by training and by experience, I was kind of struck when I came to CMCC by how they were kind of, I'm sure it wasn't done on purpose. With some faculty, maybe it is, but they were really influencing the students to think in a certain direction, in one direction. And I sort of called on some of this unique experience I had when I was registrar, when I was making every effort to just put away my biases and be open to at least getting information about things that I didn't understand. Like, for example, we have a technique in chiropractic called network spinal analysis, which you don't really touch the patient. And it's an energy technique. And I heard that patients would sometimes undulate on the treatment table like they're doing the worm and stuff when they were bringing out emotions and past things. And, some of it, gosh, in my mind, I'm thinking, it doesn't get more wacky than that. But yet this technique is allowed. And so I wanted to find out all I could about it so I wouldn't bring my own bias into the way I was influencing, our fellow professionals. And I came out of it, although I didn't understand a lot of it, I had some respect for it, at least, that the developer was a very bright individual. Possibly he was ahead of his time with his knowledge of energy medicine and the things that go on that we now know are starting to be explained by quantum physics and some of these other things that we don't understand just intuitively. And so getting back to how we just have to influence our students to be open-minded, because we take in very bright young people, and we shouldn't be afraid that if they go to a vitalistic seminar, they're going to just, convert to vitalism. They have to take all the information, critically use their critical thinking, and then decide for themselves what makes sense for them. If we bias them as faculty with treating people the way we would do it or we think it should be done, then I think we're really doing them a disservice. And so that's one thing I would do is in our colleges, I would have this discussion amongst faculty that we're an institution of learning and debate and respectful debate and respecting one another and not prejudging and not being condescending to people that don't think the way we do. We have to encourage them to be open and, be lifelong learners. And that's the way I think that we can turn out a better practitioner who will have what's best for the patients first and foremost, even though certain things may not resonate or make sense to us. It's one way we can do it that I can think of. Now, whether we'll be allowed to do it, sometimes, I'm certainly not a vitalist, or I don't see myself, but I can say that I've come more in that direction than I certainly was when I graduate, when I had more of that hardcore science bent. Just because, as you discussed with the seventh principle, and we've talked about earlier in the podcast, there's so much more to looking after patients than just, those values and all of that jargon in the scientific community. There's political views, ethical views, cultural things that all influence that stuff, and we can't ignore that.
Well said.
What you highlighted, or something that I think is really important, is making sure that we're not bashing any sort of community and trying to find a common ground and working within that. Because if you do approach it from a standpoint of sort of like I'm right, you're wrong, or you can kind of be standoffish, then no one's going to want to listen, and you're not accomplishing any goals for anyone, and that the divisiveness just ends up still existing instead of trying to find a coherency there where everyone can be involved. And I think it's gonna kind of have to be sort of almost like a group think kind of way of approaching it. I think all three of us as individuals, yes, are all on sort of the same wavelength of wanting to explore and looking at the evidence and being open-minded and willing to change in any direction. And I think ultimately the message needs to be promoted in a way where a lot of people are on that same wavelength if we want to see a great deal of change. I think, there's a lot of other barriers in the way too. So I think, institutions need to be willing to take on these types of providers, right? So having more research opportunities for chiropractors, NDs, acupuncturists, et cetera, in exploring the research and having them have a large input into what research questions are we asking, to kind of help sort of navigate that field and help it evolve. So you're having that input of sort of that vitalist component, and you're also blending in that research, and then just knowing how to communicate it effectively in a way that enhances people's way of thinking. And I think something that is important from an institution standpoint is institutions should not be promoting dogma, but more so getting students to critically think about all things. And I was lucky enough to have one mentor who I'm still very in close contact with today, who really influenced me, and would ask students, "Oh, okay, well, why that treatment?" And people would say, "Oh, well, so and so said during his lecture," and he would just stop them and say, "I don't care. I don't care what they said. I don't care about their class notes. Let me see these notes. What is the evidence for this?" And then he would, challenge the student and say, "Hey, until you find evidence to make this recommendation, I'm not listening to this." And so, and yeah, a lot of students were kind of appalled by it, because I don't think students oftentimes recognize that faculty is also flawed. And faculty is also humans. We're not just robots who look at research all day and answer these questions and then kind of teach them to the class. So there is a carryover of, hey, this is what I learned, and time to just kind of pass the torch over. And so this individual kind of really put a stop there and said, "Hey, we're not passing the torch until we kind of know what's going on here." And so I think instead of necessarily teaching like a technique or sharing perhaps a fact, but more so teaching individuals how to critically think, how to critically evaluate, how to kind of reassess questions that are being asked, and things like that, and kind of become more insightful and quizzical in these sort of settings.
Yeah, I love that. I mean, I think we're coming down. So I like the focus on students. I think that makes sense. And I love this idea, Martin, and Adam, you echoed this, of being open but critical, and or training them how to be critical thinkers, right? And that's a core a core part of the curriculum, to say, okay, you're telling me X, now I want to know what the truth is behind that. Like, don't just trust the class notes. And I think my experience in naturopathic medicine is the profession tried to just kind of stamp out the other side, and just like didn't present the vitalist side at the main schools, thinking it would just go away. And what ended up happening was what a lot of us call the shadow curriculum, where students would just go off on weekends to these long retreats and get that information anyway because they were hungry for it. But now they had no tools to explore it in detail. And that's not to say that there's other things that shouldn't be explored in the schools, but at least in my experience in naturopathic medicine, like, you can't just wish it away. And actually the core piece there is that critical analysis. And I love the idea, Martin, of actually like explicitly being open to it, but saying, please go. And this is why we don't teach this here. these are some questions you might want to consider asking. These are the things that you should ask of your professors here who are claiming that we're teaching evidence-based medicine. And like Adam said, we're all human and we're all going to fail, but let's all work to get better together. So I love that. And then one other thing I just want to underline, and then I'd love your final thoughts, is Martin, throughout you're talking about respect and working together in a respectful way. And I've also heard you use the word like mature, like a mature approach would be. And I think the way I heard that is as a profession matures, and I don't think this is condescending at all, as a profession matures, we are able to ask the hard questions. It's less of a existential threat every day that they're going to stamp out the profession. And we have that comfort, that maturity as just age as a profession, where we can begin to look internally. And that is like the definition of maturity, right? If you look at like social sciences and psychology, like when you mature, you have that ability to question your own internal values, et cetera. So I really like that. And I think that is key. And I think it is time for these professions to look more inside. And I don't think we have to be as existentially terrified as I think some of our political members feel that we should.
Yeah, I would agree. There is a paper written a few years ago by some of the top respected researchers in our profession, and the theme of it was, is it time for us to have a divorce and go in that direction, as you stated, of almost two separate professions? And a lot of people, faculty and in the science community, just thought that was a great idea. They embraced that. They say, yeah, it's about time. We should just admit that we're not getting along and things will never get better, and let's just divorce. One can call the profession something else and something else will be chiropractors. I thought that was a terrible idea. And frankly, after 41 years, I'm just finding it old and kind of boring about this us versus them, us versus them. Are you one of us or are you one of them? But I just think that we have more in common than we think we do. And if we don't have these preconceived ideas about one another and just talk to one another and associate with them, it's much the same way as, this is something that may or may not surprise you. In my province of Manitoba, 35, 40 years ago, medical doctors in their code of ethics were not allowed to associate with chiropractors, not work with them, not take patients from, they weren't supposed to associate with them. And how is that in the best interest of patients? So we just have to start talking, dialoguing, be inquisitive, and find our commonalities, our common ground, and then figure out strategies to at least coalesce where we can accept each other's differences without being enemies and fighting each other, turning our guns inward instead of doing what's best for patients, what's best for healthcare.
Yeah, and I think just to add to that, having that interprofessional divide or intra-professional divide is the worst outcome out of all the options of, well, we'll just split up the profession into two parts, one that does whatever they want and one does, quote unquote, evidence-based medicine, or however you want to kind of splice that up. But I think that just makes it worse. Because one, you're not coming to a solution, and then two, you're just kind of entrenching both ideologies, and then it becomes black and white of like, well, which camp are you? Are you with us, or are you with them? And it doesn't open up a dialogue. It doesn't solve the issue at hand. It just makes matters worse. And then I think from an interprofessional standpoint, by not being allowed to associate, then that also causes harms from a number of places. One, you kind of lose this ability to kind of explore more research questions of like, well, hold on, let's see like what the chiropractors are doing, kind of explore that a little bit and see how that would influence my practice, or let's see what the NDs are doing and how that would influence my practice. Two, then you have patients who are still going to see those other providers types anyway, and a harm there may be that they're not then disclosing the provider type that they're seeing to their treating physician in fear of being retaliated against, or in fear of being ridiculed by that provider. And so they may not disclose things, and then there's harms in that. And that's something that I've been talking a lot about in some publications that I've done. And, I think from a medicine standpoint, having a multidisciplinary approach and having a multidisciplinary team that is at least working with each other. You may not necessarily have to agree with each other, but working with each other and knowing how to play off of each other, I think is ultimately in the best interest of the public and of the patients.
Beautiful. I love it, guys. I think this was a great conversation, one of the best we've had. And thank you, dear listeners, for bearing with us. I know we got into some of the nitty-gritty of our professions and got into some philosophy land, but we like to jump back and forth between going through actual papers and talking big picture stuff. So I hope you enjoyed this as much as I did. Thank you so much, Martin, for joining us. I think that was a wonderful conversation. Thank you for bringing that conversation to the floor at PI, and I hope to continue that moving forward. And so maybe we'll talk again soon.
Hope so. Thank you. I enjoyed it.
Okay. Take care. Bye-bye. If you enjoy this podcast, chances are that one of your colleagues and friends probably would as well. Please do us a favor and let them know about the podcast. And if you have a little bit of extra time, even just a few seconds, if you could rate us and review us on Apple Podcast or any other distributor, it would be greatly appreciated. It would mean a lot to us and help get the word out to other people that would really enjoy our content. Thank you. Hey, y'all, this is Josh. We talked about some really interesting stuff today. I think one of the things we're going to do that's relevant, there is a course we have on Dr. Journal Club called the EBM Boot Camp that's really meant for clinicians to sort of help them understand how to critically evaluate the literature, et cetera, et cetera. Some of the things that we've been talking about today. Go ahead and check out the show notes link. We're going to link to it directly. I think it might be of interest. Don't forget to follow us on social and interact with us on social media at Dr. Journal Club, DR Journal Club on Twitter. We're on Facebook, we're on LinkedIn, et cetera, et cetera. So please reach out to us. We always love to talk to our fans and our listeners. If you have any specific questions you'd like to ask us about research, evidence, being a clinician, et cetera, don't hesitate to ask. And then, of course, if you have any topics that you'd like us to cover on the pod, please let us know as well.
Thank you for listening to the Dr. Journal Club podcast, the show that goes under the hood of evidence-based integrative medicine. We review recent research articles, interview evidence-based medicine thought leaders, and discuss the challenges and opportunities of integrating evidence-based and integrative medicine. Be sure to visit www.drjournalclub.com to learn more.